Hey guys, it's the Med Studier, and today I'll be going through some tips on how to excel during your clinical years. Just a disclaimer that this is not a paid promotion and it's just based off my experiences. All the resources listed have their own advantages and disadvantages, so definitely try them out and see what works best for you. So let's get started. So, number 1, work smart, not hard. Medicine is such a dense area of study, and early on it's important to accept that you won't know everything. So the key to acing your exams is to recognize exam technique and focus on your study by doing this. The best way you can consolidate your learning is through active recall. This can include in the form of flashcards, testing each other, and more importantly, question banks. In terms of flashcards, 2 of the most popular options are Quizlet and Anki. Both platforms are free to use and use spaced repetition to aid your memory. If you're someone who prefers a platform that is a bit more user-friendly, then Quizlet may be more preferable. However, you can also use add-ons on Anki to make it a little bit more enjoyable, and this is all free. From my understanding, for more advanced features of Quizlet, students will need to pay. This comes with a price of £31.99 per year. Anki allows you to use it offline, but if you are an Apple user, the app comes with a price of £21.99. Now, moving on to question banks. There are several question banks for medicine out there, but it's about identifying your weaknesses and using them to your advantage. For instance, when starting off with your clinical year, alongside your learning and from your lectures and placements, past medicine can be a great resource to understand some key concepts. I would highly recommend using the Knowledge Tutor feature of this platform in order to truly grasp the key exam buzzwords. Once you feel confident in a topic area, you can then also use the question features to try exam style questions. If there are still areas you keep getting incorrect, then make a note of this so that you can review it using the textbook feature or other preferred resources. When you get the hang of this methodology, repeat it. The pricing of PassMed is completed annually with a price of £30, but there are also other options. So, what do you do when you get your answers wrong? If you've answered a question incorrectly, make sure to thoroughly go through the notes section of that topic. If there's a key concept you're not familiar with, perhaps add it to your notes or to your preferred flashcard method. Now, moving on to using past medicine for exam revision. This is definitely the go-to resource for medical students. Closer to exam time, I would highly recommend aiming to do around 100 questions a day, usually at least a few months prior to your exams, for example, around 4 to 5 months beforehand. So try to practice questions in all categories. This can be daunting at first, especially when you've not even learnt some of the topics. However, it undoubtedly trains your brain to think broadly. In an exam situation or even in clinical surroundings, you'll not be given a specialty or the category that the patient's coming in. The questions can come in a random order. So different exam question platforms have different styles. This will also allow you to see the same type of question in a different style. If you're in the later stages of your clinical years, so when you get closer to your finals exams, it might be worth trying out other platforms as well. Firstly, QuestMed has been quite popular recently among students. It's similar to PassMed in the sense that you're able to study in categories until you feel a bit more confident. There is also a spaced repetition flashcard feature present to supplement your learning. And after trying out QuestMed, I would definitely say that this is a more challenging platform. You're expected to reach the answer from less information from other resources, which can be quite similar to the MSCAA platform. However, this can be an advantage and can help you to tackle those more difficult questions in your exam. PastTest is also another popular resource which I've come across. This is quite similar to QuizMed in the sense that the questions that you come across are quite difficult. Therefore, it will definitely help you to tackle the more advanced questions in your exam. So PastTest is definitely a platform which I would personally recommend just before your finals exams, and once you feel a bit more confident with your learning. Something which makes PastTest stand out is the fact that it has university-specific question banks. There are also other key features including spot diagnosis, podcasts, videos, and much more. Now moving on to number 2, which is make every day count. Studying medicine is not like studying GCSEs and A-levels where some of you may be able to cram revision last minute. Due to the immense breadth of knowledge, it's so important to do small bites of revision throughout the year. This avoids unnecessary stress and all-nighters near exam time. In particular, focus the start of the year to understanding the topics, and then the second half of the year try to consolidate your learning with exam-style questions and practice. And finally, quantity over quality. Like I've mentioned earlier in this video, the most important thing to remember is that you'll never be able to know everything in medicine. So focusing on quantity over quality whilst revising will help you to spend more time over a range of topics rather than spending hours understanding just one. And that brings us to the end of this video. Hope you guys found it useful. Please remember to like, share and subscribe, and follow me on Instagram at The Med Studio.